Hi everyone, welcome to the Lakeview video podcast series. I'm pleased today to be joined with Berkeley Dains, who's with Changing Tides Addiction Treatment, among other things, out of Ventura, California. Welcome, Berkeley.
Thank you. Thanks for having me.
Really glad to have you here in Jacksonville. You've got a great story, and if we had more than 5 minutes, I would love for everyone to understand your background and your history, because we've had a chance to sit down and talk in the past about your recovery journey and what got you into the field. Could you tell us just quickly, that one key thing that got you into the field as we move into talking about, why you do what you do and the kinds of work that you're doing?
Absolutely. So basically, I hit my bottom, physical and mental bottom. I had a spiritual awakening. Mm-hmm. And I've been driven ever since that day. Mm-hmm. It was May 14th, 08. I hit my knees. Didn't know what I was praying to, but I was praying to something to have all this stuff removed from me. Mm-hmm. And right after that, I found out what my purpose in life was, mm-hmm. to help other people get completely unstuck. Right. Get out of that vicious cycle of addiction.
Right. And so I'm going to read this because it's really impressive. Your credentials: California State Certified Level 3 Addiction Treatment Counselor, Nationally Certified Mental Health and Addictions Interventionist, a CIP, mm-hmm. Executive Director and Founder of Hollywood Beach Recovery, Sober Living, and CEO of Changing Tides Treatment Center. And they also call you the detox guy.
Right.
So you've got just an impressive set of credentials. Can you tell me first why the detox guy?
Well, that happened through the intervention process, mm-hmm. Because every client I get has to go straight into detox. Mm-hmm. People are like, how can we get this guy into detox? And so I'll call Berkeley, he's the detox guy.
Okay, right?
Uh-huh. So that just kind of grew, and it tagged on. People start sending me gifts that have that engraved in it. Uh-huh. So I was like, it was pretty cool.
Yeah, and it's interesting, I shared this story with somebody earlier. When we spoke a year or so ago, I asked, I said, so you must only do interventions on sort of like the bikers and sort of the rock stars and stuff. And you're like, no, I do interventions on 80-year-old women. Yeah. And so what's that been like for you?
It's been pretty amazing. It's, sometimes people that are in their active addiction, they gravitate towards me. So mm-hmm. It's like I said, the 80-year-old woman, she was in South Florida, mm-hmm. And when her husband opened the door, he was kind of like, oh, but her and I immediately had a bond like mm-hmm. right away, mm-hmm. So yeah, I deal with professionals of all sorts, and me looking so different than what they're used to, mm-hmm. that kind of just throws them off a little bit.
Sure.
Some people feel threatened. When they feel threatened, I just sit on the ground. Mm-hmm. Sit cross-legged and just look up. Say, hey, what's up?
I love that.
Yeah, and that works with everybody.
Right, that's so great. It's true.
Takes the power out of it.
It sure does. And so you've opened up a new program called Changing Tides Treatment Center. Mm-hmm. It's in Ventura?
It's in Ventura, yeah.
Okay, so tell us about it.
Yeah, so Changing Tides Treatment, so it started off as just an outpatient program mm-hmm. in conjunction with our Sober Living. Mm-hmm. We just recently got it state certified as a residential treatment center and subacute detox. Mm-hmm. So they come through there, they can cycle through that program, and then move to our graduate house, which is Surfright or Sober Living, mm-hmm. where they can continue and do IOP and PHP. Mm-hmm. And then in that phase, that's where we get them into action, help them find jobs, do resume writing, mm-hmm. Mock interviewing, or get them into one of the colleges. We have 3 great schools that are right next to us.
Fantastic. So you do like a recovery-oriented care model where you're really trying to help them prolong their recovery by building that safety net for them.
Exactly. And, the longer we can keep somebody in a structured environment, the better treatment outcome's going to be.
That's fantastic. So you offer different levels of care. You said detox to sober living. At which level of care do you see the most change occur with your patients?
I would say the most change probably towards the graduate phase, mm-hmm. Because that's really where the lights are on. Mm-hmm. The lights have come on and they're eager to get into work and get into school and stuff like that. And that's also where we have to be very, very careful. Mm-hmm. Because they do that 7, 1, 2, 3 and out. Mm-hmm, mm-hmm. So we have to slow them down right there and remember this is what's working for you.
Right.
Just like somebody who's bipolar, they have to take the proper medication. As soon as they stop, stuff happens.
Sure.
Same thing with us that are afflicted with addiction issues. As soon as we stop doing what works, we do it right back out. There's Absolutely. Just a matter of time.
Yeah, you have to slow it down and kind of take it small steps, right?
Exactly.
And just out of curiosity, is your program gender specific, or is it men only, women only?
It's advertised for both men and women,
okay.
But we've had 3 women the whole time that we've been open.
Okay.
Yeah.
Okay.
And then all of our therapists are master's level and PhD. We have a medical director, Dr. Deborah London, she's a psychiatrist.
Okay.
She's also a psychopharmacologist and very holistic and very, very good at what she does.
Fantastic. I'm really excited to see your place. If someone were wanting to get in touch with you to know more about Changing Tides or about the sober living or accessing your interventions, how could they get in touch with you?
Absolutely. So you can call our 800 number, 844-88-DETOX, or you can call me directly at 805-506-1541.
Thanks, Berkeley. It's really nice to have you here. Thanks so much for joining us. For those of you that are interested in accessing treatment at Lakeview Health or wanted to learn more, visit us at lakeviewhealth.com. If you know someone that needs treatment right away, we ask you to give us a call at 866-887-0142.